Hey everybody, we're back starting our first Cabral HouseCall of the weekend. If you are a long-time listener to the show, we very much appreciate you being a part of this community. And for anybody new to the show, every single weekend we answer about 10 questions or so from the community, 5 each day. And there's no prep done for it. There's no editing of your questions. And if you'd like, you can write in at stephencabral.com/askcabral. And again, free service, no charge. We just want to be able to pay it forward. As I've said many, many times before, I was very fortunate to be able to find a mentor back when I was sick that was able to answer many of my questions, bring some clarity to the situation. And if I can do that for others, of course, I would love to do so as well. All right, so let's get into it. Let me just open up our document for the day. And I have to now scroll to episode 3403. So 3403. If you are looking to follow along with the questions, head on over to stephencabral.com/3403. All right, let's dive in. First question's from Anonymous. Anonymous says, "Hi, Dr. Cabral. I'm convinced I have lipidemia. I haven't been to the doctor yet to confirm. My torso and arms and legs all feel achy, like I have grainy, pebbly texture beneath the skin. My knees have a weird fat pad on the side. I listened to another show you mentioned." Okay, my team wrote a note in here. And we usually just kind of delete these out. My team's just putting them in. Again, all questions get answered. There's no censoring or anything like that. Especially if you tuned in last weekend about different types of cloud seeding someone wrote in on. This was answered in episode 3375. So they put a little note here just to remind that every question gets answered. If yours hasn't been answered yet, we've got about an 8-week queue. So it takes about 8 weeks to get your questions answered. Sometimes it's been down to 3 weeks. Other times it's been up to 13 weeks. But every question comes through. If yours hasn't been answered in, call it 8 to 10 weeks, you can, and by the way, you should hopefully be tuning in on the weekend shows. You can always just email and ask us, hey, was it answered? And you can do that at support@stephencabral.com or just at cabralsupportgroup.com. All right. So Anonymous, your question was answered on 3375. All right. Another anonymous question, but from a different individual. Dr. C, thank you for all you do. I'm a 52-year-old postmenopausal female who's pretty healthy. Dove into your supplements and Equal Life Detox about a year ago. Now, recently, I have normal labs by my medical doctor with the results of my alanine, your liver-based enzymes. Yep. Serum slightly elevated from last year, 10 to 34. Mine was 53. Last year it was 35. Negative for hepatitis, not a drinker. Cholesterol is good. Weigh 110 at 5'2". Ultrasound shows a healthy liver. Could it be certain supplements? Thanks in advance. P.S. I've done your 7-day detox 3 times now, and we'll do it again in May. All right, excellent. So basically, this individual is asking, why might liver enzymes be elevated, which shows inflammation, on a blood work test, right? And so it's good that you wrote in that not a drinker, right? Don't drink alcohol. Cholesterol is normal, all of the things. Because remember, like 1 in 5 had non-alcoholic fatty liver disease, so we always have to figure out why. So all we know from these liver enzymes, we don't know why. Right? We just know there's inflammation in the liver. It's like CRP, right? High sensitivity CRP. We know that there's inflammation in the body. We don't know why. That's the unfortunate thing. But I mean, even with your complete blood count, when your MCV and MCHC and all of those are off, it could be iron, could be vitamin C, could be copper, could be B12, B9. Like there are other reasons why. So we kind of have to look at all of it. But what I'll do is I'll probably do a whole show on liver enzymes being elevated. I think it's a good topic, and I definitely haven't done it yet. But I will share with you that there aren't a lot of supplements that will increase liver enzymes. But I'll definitely do a show on this. But some, like if you really overdo kava or black cohosh or even EGCG from green tea, you need to really overdo it, but it's possible. And then there's, very, very specific herbs. But I would say that a lot of times it comes from medications. So like acetaminophen, it can come from certain prescription-based drugs. It can come from hormone replacement therapy. That's a reason as well. Or it could be environmental-based toxins that you might have got exposed to. That's always a possibility. Statins, I'm assuming that I know your cholesterol is good, but I'm assuming you're not on a statin because that could raise it. So there's a bunch of different reasons. It could be high levels of iron, wondering if you got your iron tested or not. So bunch of different reasons. I'll do a whole show around it so that I can go in depth, because I can only, dedicate basically 2 to 3 minutes per question, but I want to make sure you get this answered, and it's a good topic for a show. So there's always a reason why. I probably wouldn't test your liver enzymes directly after a detox. I'm assuming you didn't, because you're filtering more through your liver, but you're also giving your liver all that support. All right. So hopefully that's helpful. And we'll get a whole show on it as well. All right, Anonymous is up next. Hey, Dr. Brawl, love listening to you daily. Thanks, Anonymous. Appreciate that. Question: how important is it to take creatine if you are in menopause? I want to maintain healthy muscles while strength training, but not really a fan about how I hear it may bloat you. Thanks for all you do. Yeah, this is a great question as well. We actually have an amazing product coming out. I can't talk too much about it. Wait for it in July. You'll be able to see. And here's the thing. I'm going to give you a couple things about creatine. Yes, it's fantastic. Yes, it can be really helpful. You need to make sure you're doing all the foundational things first. You shouldn't take creatine if you're not using something like a daily activated multi, or the daily nutritional support, or omega-3 support, vitamin D3. What's the other one that I always want people to use? It's just some zinc, some good quality vitamin C. All those different things are more foundational, but creatine can be exceptional. Now, here's the thing though. There's nothing wrong with starting at a smaller dose, meaning like women and men can get results at 3 grams, even 2.5, 3 grams. It doesn't need to be 5 grams. Now, 5 grams is the most clinically studied, which is great, but there are other things I can't talk about here today. You'll see them in July. That could be really helpful. So we'll keep it at that. People that have a difficult time absorbing creatine often do better when taken after the workout, when the body's a little bit more receptive. Also, they do better sometimes if they add it to a smoothie or even a meal in a drink, so that it's not just on an empty stomach, because that could cause GI or maybe bloating, but not for everybody. So start smaller if you want, and then see how you do with it. All right. Yeah. And I can't talk too much about July, but definitely tune in, because that'll be a big fun one. All right. Let's see who is up next. We had 3 Anonymous in a row. Well, we've got a 4th Anonymous, and believe it or not, this one is from a different individual as well. Nobody wants to leave their name. It's okay. It says, I recently did my second DNAge test included in my High Performance Health membership. I was shocked to receive the results indicating that based on methylation value, I had an additional 6 years in 8 months. I basically follow Dr. Brawl's lifestyle recommendations to the letter. I eat a primarily Mediterranean diet, detox 4 times a year, sauna, resistance, cardio, prior to sleep, PMF mat, minimal to no alcohol, and practice meditation and mindfulness. Additionally, I do the big 5 4 times per year. The only 2 things that have changed in time between tests is that I've eliminated a very low dose of estrogen and progesterone that was once prescribed for postmenopausal symptoms, and I've added cold plunge 3 times per week. I'm 63 years old. Please advise. Yeah, happy to help with this. So again, always keep in mind that there have been many people and many of my colleagues who have shared this online as well. If you suffered a viral-based infection or anything like that within the last 4 to 6 weeks, and you take one of these labs, it's going to show that, and you will look biologically older. Literally. Anybody who had COVID or H1N1 flu or anything like that, if you do yours literally within the next 4 to 8 weeks, that took an effect on your body. Literally, it ages the body. Now, here's the nice thing. You do the age reversal things, and then that biological age goes back down. It's not always static. Mine ranges anywhere between 0.69 for rate of aging to maybe like 0.73. That's kind of where I've been in that range. But even when I was younger, mine was much higher. I've shared that. When I was in my mid-30s, my rate of aging was ridiculously high. Why? I had a baby at home. I had just put my entire life savings into opening up my second location, my wellness center in Boston. I was working literally 80 hours a week with a baby at home, all of those things. It was crazy. And my rate of aging was horrible, right? Luckily, we're able to reverse those things. So now my rate of aging more than 10 years later is actually younger than it was, when I was in my late 30s. So you're on the right path. If you do the right things, you will see that improvement. And then just again, the cold plunge, as long as it's not too much of a stress on your body, should be totally fine. That's all. So just make sure there was none of those inflammatory events that took place over the previous month. Wait 8 weeks, retest it again. All right. And then, so hopefully that's helpful. We'll keep it at that. And then we're happy to answer questions as well inside the private Facebook group for HPH. Emily's up next. Emily says, my partner, 23 and a male, has recently started experiencing debilitating anxiety. This is not normal for him, and he has not experienced anxiety like this before or at all. He was sick this last month with 140-degree fever and for a few weeks was experiencing skin sensitivity in certain spots. What would you recommend in helping navigate this new anxiety and help him start feeling normal again? Yeah, again, I can't begin to describe this enough. Post-viral inflammatory syndrome is a real thing. People call it long COVID, long this, long that, whatever you want to call it. It's fine. It's always been around. It's called post-viral inflammatory syndrome. It is possible that our previous writer-inner was experiencing just that. I've experienced it myself. Like it's a legitimate thing. Now, some people takes them longer to recover only because they're not giving their body the proper nutrients that it needs. Your partner might have wiped out a lot of those B vitamins, zinc, vitamin C, and the body now isn't able to deal with stress in the same way. This is a legitimate thing. I mean, I can't begin to share with you, just because I've been doing this for a long time, the amount of people that have overcome all sorts of mental health-based challenges with getting the right nutrients into their body. And I wouldn't say that if it wasn't true. Do I believe in therapy and all of those things? Of course I do, 100%. But we can do both, right? We can do both. I talk about that in the rain barrel effect. At minimum, Emily, just try even just 1 month of the daily nutritional support, daily fruit and vegetable blend, 2 omega-3 soft gels a day, vitamin D3, and if I could give you one more, the daily probiotic support. That's our daily foundational protocol, level 2, and you would add the vitamin D3 at 4,000 IUs or 100 micrograms per day. Again, I can't give any medical advice, medical treatment plans, medical cures, medical diagnosis. That would be my minimum. And then if you want, add an extra bit of zinc, like the FM zinc or the Balance zinc. Definitely recommend that. Yeah, just that. It would be, in my opinion, that's worth the investment for sure. These are just things that everybody needs. They really do. But particularly after 104-degree fever and being wiped out and probably inflamed. All right, let's build that body back up. That's it. All right, Kay is going to be our last question for the day. Kay says, hi, Dr. Brawl. Thanks so much for your great podcast. I look forward to them each week. Thank you, Kay. Appreciate you. My question is, what are your thoughts on the use of testosterone to help postmenopausal women maintain muscle mass and bone health as well as hypoactive sexual desire disorder? My physician is recommending a small amount of a compounded formulation of testosterone to be injected in the subcutaneous skin layer every 10 days. Are there any less invasive and more natural ways to achieve the same benefit that you would recommend? I've heard that testosterone is a controlled substance, and I'm wondering if it could potentially lead to side effects such as hair loss in the head and hair growth in unwanted areas. Thank you. Yes, Kay, it absolutely can. Deepening of the voice, thickening of the brow of the face, thickening of the chin, thickening of the skin, and unwanted hair growth, etc. Now, small dose, sure, could be potentially fine. Here's the issue. Once every 10 days, what are they doing? They're giving you a larger dose every 10 days, and then it gradually drops over 10 days. Then they give you another large dose, then it drops over 10 days, and then they do it again. It's not my favorite way to do that. The way that I help women, I literally just finished testing this or teaching this in IHP level 3 with a menopause and fertility test, which is at StephenCabral.com/shop. That just takes you over to EcoLife. And that's the best thing to do. Or if you're already in menopause, you can run the stress, mood, and metabolism test. We use a product called estrogen support for low estrogen levels. We use a product called progesterone support for low progesterone levels. We use a product called DHEA to support progesterone, estrogen, and testosterone. It is the most natural way to do it. The most natural way to do it with basically zero side effects, because you're getting a precursor to your hormones, which is DHEA. And you start small, 5 milligrams twice a day. Then you retest your labs, the stress, mood, and metabolism test after 12 weeks. You say, okay, how's estrogen look? How's progesterone look? How's testosterone look? Oh, I could use a little, it worked, but I could use a little bit more. Okay. We increase the DHEA by 5 to 10 milligrams, still a low dose, still less than 50 milligrams, which is typically the recommended dose. And then that's how we dial in and exact. And this is access to anybody. This really is the future of health. It honestly is. And it's all available to you. And I teach all of this in my course for the general public at StephenCabral.com/courses. That is a female hormones course where I teach this. But yes, this is exactly what we do. So if you think about this, okay, when my wife reaches menopause, again, I've worked with thousands of menopausal and perimenopausal women in my practice, maybe 10,000 appointments legitimately. And so, and my wife, when it gets to this point, she's not going to be using, she'll be using the estrogen support, progesterone support as needed and dosage based, and then DHEA. When my testosterone starts to drop one day, I'll be using DHEA, and then I'll use a product called Daily Male Support, which is an herbal-based product to boost testosterone naturally as well. So that's how I've used it in my practice. I've seen it work great. I've got the lab results that back it up. And of course, that's what we want to use for everybody because it's the most natural. So, and then again, I can go through all of the detail, but there's a time and place for certain compounded estriol or compounded DHEA creams, or hyaluronic creams for vaginal dryness or vaginal atrophy during menopause. But that doesn't mean that you need to put it in hormones in orally. It could always be less absorbed systemically and more just as you need it vaginally as well. I teach all of that in level 3 as well. If you're an IHP, you can certainly get that information. All right, everybody. Hopefully this was helpful, and I'll be back tomorrow answering more of our community's questions. Thanks, everybody. Take care. Have an amazing weekend. Thanks so much for tuning into today's show. Before you go, don't forget to hit that subscribe button. I want to make sure that you're getting our daily content, not missing out on anything functional medicine, wellness, weight gain, weight loss, anti-aging, living longer, stronger, and all of the most cutting-edge research. And if there's any topics you want to hear, feel free to leave them in the comments below. Take care.